And we just have to remember that. It's just really hard for people to make the right decisions for the right reasons. So we need to give them the ammunition that they need to think through so they make decisions for themselves. Because a lot of these decisions weren't for the right reasons. They were for all the wrong reasons. And they have the evidence to prove it. Now, the thing with chlamydia, I can treat that. If people know they have it and they come in, we can treat it fairly simply. But herpes, human papillomavirus, I call those the gifts that keep on giving. Because you can get rid of the lesions, but you never get rid of the virus. And we know that that's going to have long-term effects. We're already seeing the rates of anal cancer, oral cancer, types of cancers related to human papillomavirus all on the increase. So again, we need to talk with our young ladies, with our women, and help them be strong so that, again, right decisions for the right reasons. Again, what are the complications, even in the short term, are that they can get severe infections, they can lead to scarring, tubal pregnancies, all sorts of things for our young women. We don't want them to have that. That's not a way to go to college or whatever. Now I want to talk just a couple minutes about some things that don't affect all women, but disproportionately some women more than others, just to give you an idea of what maybe some of your sisters here in Fort Wayne are actually going through. Feeding their children. This is a new concept for a lot of people, including myself, really understanding the whole concept of food deserts and food insecurity. Food insecurity has a lot of different definitions, but quite simply it means people aren't sure whether they have enough food to make it through the week. That happens here in Indiana, it happens here in Allen County. Now, we're very blessed that we have some good resources here, our Community Harvest Food Bank, Associated Churches Food Bank, those sorts of things, WIC, those kinds of programs. But there are a lot of families here, even in Allen County, that aren't really sure if they're going to have enough food to make it through the week, and that's been well studied. 16.2% of Indiana children experience food insecurity. I don't know about you, but that's unacceptable to me. That's just not right. There's something wrong when that's happening to that many kids here. We actually ranked number 9 in the most recent survey that was done because we had one of the largest increases in the number of kids that experience food insecurity. I'm sure a lot of that obviously has to do with the economy and that we're a largely manufacturing area. But again, this should be unacceptable to all of us. The reason why for kids, there's a lot of health problems. Remember, they're still growing, their brains are still growing, everything about them is still growing. And we know that kids who do not have proper nutrition, kids that live in a perpetual state of food insecurity, have all sorts of issues. Kids younger than 3 years who live in food insecure households have much greater odds of having poor health and being at increased developmental risk. Now, I don't know about you, but I want all kids to have the opportunity to grow up strong and healthy. I want them to go to college. I want them to get a good degree. I want them to get a job. The reason I want to do that is not only for them, but for me, because I need someone to pay my Social Security, because I do want to retire at some point, and I'm counting on this younger generation to be there to do that. So they have to have good jobs, and they can't do that if they're not developmentally mature. We need to make sure that our kids have what they need to become developmentally strong. It also has a huge impact on the mental health of children. And I'm sure there are other factors going on in these households. It's not just food insecurity that's impacting these children. But that's something we can do something about. That's fairly straightforward and easy, where some of the other problems may be more difficult for us. But again, when you look at the kids, I think this study was done in Baltimore, where they looked at kids who had severe food insecurity, 4 times more likely than their peers to require mental health counseling, 7 times more likely to be classified as clinically dysfunctional. And what happens there? You're kicked out of school. That's what happens. 7 times more likely to get into fights frequently. Again, kicked out of school. We need these kids to be educated. I don't know if you know this, but Indiana ranks 46th in the percentage of adults that have a bachelor's degree. We need all of our kids to go to college, get a certificate, get some sort of advanced training so they're not competing against absolutely everybody for every job. Infant mortality, again, that's one of the biggest indicators for a country, actually, on how well your country takes care of its own. That's the way I look at it. It's really a big indicator. It's the number of deaths in children less than 1 year per 1,000 live births. And low birth weight is when babies are born less than 2,500 grams, and that's the biggest reason that we have for infant mortality in Allen County. In Allen County, we see a big disparity, and this is a national trend, where you see that African Americans are more likely to suffer infant mortality than any other group. Caucasians, Hispanic, Asians, it doesn't matter, and that has been around for a long time, and to be quite honest, we really don't know why that occurs. We're not really sure why that occurs. We actually had a big blip in 2006 where we had 31 babies die, or our rate was 31 per 1,000 live births. which you can see is significantly higher than we have for the other groups. Not really sure why that is, but it's something that we need to try and figure out if there's something we can do to impact that number. Again, looking by race, if you look at, it was interesting that year in 2006, not really sure why, but Allen and St. Joseph County both had a big increase in the number of children that died. And again, just looking at it again, you can see that this is a national trend. It's not just local, it's not just an Indiana thing, but even though it's national, we need to be concerned about the babies that live here in Allen County. And again, when we look at the causes of them, if you look on the left, you can see that low birth weight is one of the biggest reasons, and by far more than for the Caucasian babies that died. And again, we're not sure. Are they not getting the prenatal care that they need? What are the issues that are causing this? And that's something that we're looking into here locally. Health Visions and the Minority Health Coalition and Linda Fink from IPFW have formed a group, and we're looking into that to see if there's something we can figure out that might bring that number down. Cancer disparities. That's another thing that has a racial disparity. According to a report by the American Cancer Society, the death rate for all cancers combined was 32% higher for African American men and women, and 16% higher for African American women than their white peers in 2007. That's a huge disparity. Again, we're not always sure why that happens. Breast cancer accounted for 37% of the overall cancer mortality disparity between the races and women. With mammograms, there's no reason why we need to be having that now. We need to make sure, and we're very blessed to have a Matthew 25 and a Francine's Friends. There's no reason why every woman in this audience who needs a mammogram isn't getting it here in Allen County. Who enjoys getting their mammogram? Yeah, nobody enjoys it, okay? You're not alone, but you gotta do it. It's something you need to do for your health. Death rates from breast cancer had been similar for African American white women in the early 80s, but by 2003, 2007, were 39% higher for African Americans. And again, not sure why that is, but that's unacceptable. That's unacceptable. Limited family support. One thing that I've had the opportunity, again, I see a lot of different people in the infectious disease clinic at the Department of Health, and I'm amazed by how many women were orphaned as children. They don't have a father. They didn't know their mother. She died when they were younger. And how many women don't have that role model to show them how to be a young woman, how to be a mother, how to age, how to handle all of the stressors that you and I go through every day. And what a loss. I've really had an opportunity to see up close and personal what a loss that is, what a vacuum that is in somebody's life. We need to do a better job here in Allen County of making sure that all women have support, that we reach out, and for these women that have that vacuum in their life, is there something we can do to fill that void? Because I can't imagine, life is hard, life is complicated, and how to do that without somebody blazing the trail for you. Call your mom up and ask a question. Geez, so-and-so's doing this, what should I do? Do I need to be worried? Take him to the hospital. If you didn't have that person, what would you do? So again, I think we need to do a better job at understanding that not everybody came from the same Ozzie and Harriet, Leave It to Beaver, Cosby family, whatever, nice family setting. Some people have had a very hard time raising themselves, essentially. But there is some good news. Okay, we got a lot of health issues, there's no question, and these are complicated times. And let me tell you, all the easy work's been done. All that's left now are complicated issues that have multifactorial etiologies and so forth, and they're going to take sophisticated and collaborative solutions. But I do believe we can do that. We have a lot of people here in this community and a lot of rich resources. We have a well-developed trail system. No reason why people can't be exercising. We've got trails here, one of the best trail system in Indiana. We have a lot of YMCAs that offer scholarships, that offer discounts. Again, no reason why we can't be getting some exercise. For those people that are overweight and are pre-diabetic, they actually have a new program at the YMCA that can actually help you achieve your goal of losing some weight and bringing that blood sugar down so you don't have to go on medicine. For kids, again, remember I said about 15% of our kids are overweight. Parkview has a great program for kids to help them lose weight and help build their self-esteem so they feel good about themselves. Lutheran Bariatric Center for people where that's the best option for them. We have a very sophisticated system, and they're able to do really absolutely amazing surgeries now with very minimal time off work or anything for people who suffer from this. We've got some very strong social service agencies here. We've got a very active mental health community. We have Park Center, which is a community mental health center. We have Community Harvest Food Bank and Associated Churches, as I mentioned. Our WIC program is very good, helping moms with children under 5 with nutrition. Health Visions and Minority Health Coalition, helping to address a lot of these gaps that we have in terms of health disparities. Healthier Moms and Babies, helping high-risk moms bring their babies safely into the world at term and not going into preterm labor. Can I helps with a lot of programs. We've got our township trustees. There are a lot of resources here, but people need to know how to access them. And that's one of the biggest problems I see, is that people don't know where to go for help. We also have a very strong healthcare community. Every year, the Robert Wood Johnson Foundation issues a ranking of each state and all the counties in that state. And last year, we received ours, and Allen County was actually ranked 10th in clinical care in Indiana. And what they're looking at there is access to care and quality of care. And 10th, I think, is very good when you consider the complexity of the people that we take care of here in Allen County. Our doctors take care of, again, rural people, foreign-born folks, older, younger. They get a lot of complicated cases referred from outside communities, outside counties. So again, very good. We have very strong safety net organizations. Most communities don't have a Matthew 25 that provides full-service care, medical care for indigent folks, or a neighborhood health clinic, a federally qualified clinic. So we're rich in resources. Dynamic cancer research, and Dr. Malkus is going to talk to us about that. I mean, IU is really known for its cancer research, and we're very lucky not only to be able to have all that great research being done at IU, but I know when I have a complicated patient, I know exactly where I send them for a second opinion or for a first opinion, and we're very blessed to have that here as a resource. So in summary, we are a very diverse population. We have a lot of health issues, but we also have a lot of resources. But it really requires us coming together as a community of women. They're going to help our young people learn how to navigate the system. We're going to help our older women age gracefully. And that's what we need to do to realize all of those great ambitions and goals that they were talking about earlier. But it doesn't start unless you're healthy, both physically, mentally, and spiritually. And that would be my wish for you. She asked, what was my magic wand that I would wave, or what was my wish? That you all find that balance, that center of health, where you can be the best version of you that you can be.